Hi, I'm Teresa Younkin. I am the CEO of Mosaic Life, which is an AI-driven wellness app, as well as a health informaticist. So you'll find me here every week talking about all things AI, fire, and value-based care. Thank you for joining me. So we're going to continue our discussion on the exploration of AI in healthcare. And this week we're going to dive into how predictive analytics is revolutionizing value-based care. What is predictive analytics? That's the ability to forecast health outcomes and costs. And that is necessary if we're going to shift our models to be more efficient and to be more patient-centered. AI is transforming how we anticipate and how we're going to manage patient health. And you do that by analyzing a lot of data from electronic health records, from claims, and even from social determinants of health surveys. With AI, models can start to identify patterns and to predict potential health risks with remarkable accuracy. One model I want to talk about is the large medical model, and that was developed by GenHealth AI. And they've demonstrated some pretty impressive numbers at predicting total patient cost of care and risk factors. It is one vendor who's out in the market right now. I chose them because I liked the work that they were doing. The model, specifically this LMM, large medical model, it leveraged healthcare specific approaches to generative AI. So they built out this model with healthcare in mind. When they did that, it outperformed a lot of traditional healthcare benchmarks. One of them stated it was like 14%. That's huge to have that amount of a reduction in healthcare cost and an increase in risk prediction. This particular technology, it was architected to work with Fire HL7 and X12. So it hits all those pain points that we talk about when we're talking about integrating all kinds of different data sources. As we look towards 2025, what we're going to find is that there's going to be a lot more creativity in the architecture of AI. Cost prediction models. What cost prediction does, it helps providers and payers anticipate the expenses and how they're going to allocate their resources more effectively. So when I'm saying resources, it's not just dollars, it's how many nurses do we put on this particular project? When do we engage with a pharmacist on this project? So we're looking at allocating resources effectively and letting people work at the highest level of their licenses. Now, these models, they typically incorporate various data points. And you've heard of these before, and they're not new, but we can bring more in, and we can bring in structured and unstructured data, which has always been a limitation that we've had in the past. So AI is allowing us to bring in patient demographics, not just the box that you check about what race or ethnicity that you are, but if something has been spoken about in a note, we can bring that in and using NLP to dig out these nuggets and gems when we're looking for specific demographic information in a patient population. It can look at medical history. A lot of these notes are written in hand. If we're looking at a longitudinal record, what's going on right now? We can take a lot of our medical records, take these and look at current health status because we can read from other notes that have come from other providers that may not be integrated as discrete data into our EHRs. We can look at social determinants factors. We can look at real treatment plans and interventions. What worked previously for this particular patient? What didn't work previously for this particular patient? Really important when it comes to drug discovery. Because we are starting to see more advanced uses of these AI models, we are really starting to push the boundary of what's possible when it comes to cost prediction. With AI, you can do things like leverage trillions of healthcare events across, let's say, 100 million patients. These models are able to process that information fairly quickly, more accurately than we can as humans, and it can provide more accurate and actionable insights. You can look to any number of case studies that are being published right now. There's the UCSF study and GE Healthcare. We've got Mass Gen Publishing, Kaiser, and IBM Watson. They implemented a predictive analytics platform to enhance what they were doing around population health management. So it was there to give an assist to the physicians. The objective was to identify high risk patients and to implement some very targeted interventions to improve health outcomes and to reduce costs. Now, by analyzing patient data from various sources, including the electronic health record, claims data, other demographic data, they were able to proactively identify high risk patients. They were able to intervene with more targeted care plans. They were able to reduce hospitalizations. They improved the management of chronic conditions, and overall, they enhanced their population health metrics. Now, look what we did last year. We were just using simple ChatGPT 3.0. Now we're in these large language models. People are pulling together different sources, like the large medical model, and they're becoming more targeted and more focused on certain areas. So, as we get to 2025, the role of AI and predictive analytics is just going to continue to grow, and value based care contracts and initiatives are going to require that we have some very robust predictive analytics capabilities. Regulations and technology are pushing the future of healthcare delivery. In conclusion, the integration of AI powered predictive analytics and value-based care, it's not just a trend, it's here to stay. And as healthcare leaders, it's our responsibility to understand and to leverage these particular technologies to improve our patient outcomes, to reduce costs, and to drive more innovation. So what are your thoughts on the role of AI and predictive analytics and value-based care? How is your organization leveraging this new technology? If you want to have a deeper conversation, I would welcome you to click on my link and schedule 30 minutes and let's have a conversation. I'll catch you guys here again next week. We'll continue this conversation. Take care.